We'll be right back.
Rivers State Governor Siminalayi Fubara has approved the sum of 100,000 naira for each civil servant in the state. The bonus will go to the thousands of workers in the different ministries, departments, and agencies. The NLC state chairman said the bonus is welcomed by workers as they have started receiving the wage award. It is the first time that civil servants in the state will be receiving Christmas bonuses. The minimum wage of Nigeria is 30,000 naira.
To really appreciate the governor of Rivers State, His Excellency Sir Siminalayi Fubara, the GSSRS, the Executive Governor of Rivers State, for this Christmas offer. You know, the last time the workers enjoyed Christmas this way was far back when the former governor, Peter Odele, was in power. But since after that, up to now, no other governor has paid Christmas bonus to Rivers State civil servants. And even those that pay, sometimes it's limited to only the civil service, the direct workers in the civil service. But this offer went beyond that. So every state employed workers, both at the tertiary institutions of the states, both the polytechnics, the RS University, the Administrative University, every other tertiary institutions, so far as you are under the state control, we are all beneficiaries of this 100,000. And you will agree with me that the minimum wage is 30,000. And most states are giving at this time 50% of whatever be the salary of their workers. But the governor, having grown for a rank and file of the working class, understand that all of us go for the same market.
It's a new dawn for members of the Petroleum Tanker Drivers Branch of the Nigeria Union of Petroleum and Natural Gas Workers, NUPENG. The union rolled out a scheme that prioritized the well-being of the tanker drivers. I met with Adewale Olaide, who has been a tanker driver for more than 2 decades. He took me through his daily activities on the job. During our interaction, he agreed that sound health and mind are important for excellent delivery on the job.
Before, we don't have hope about the work they are doing. But for this thing they've done, all the drivers have the hope. Now we're happy that our union member, our union leaders have taken the health scheme as an important thing to us.
It's a new dawn for members of the Petroleum Tanker Drivers Branch of the Nigeria Union of Petroleum and Natural Gas Workers, NUPENG. The union rolled out a scheme that prioritized the well-being of the tanker drivers. At this event organized by NUPENG, the leaders announced that the union has introduced a comprehensive healthcare scheme to improve the well-being of its members.
Driving is a very serious business, and one needs to be in a top of good health to continue to do that. One major area where people die quickly is because of the inaccessibility of Medicare, and especially probably the money to provide that. So today, NUPENG has come with this initiative to provide free Medicare for all tanker drivers that are steering.
Many of our members have been dying due to minor ailments without any care, due to accidents on the highway. But luckily, we've been able to save money to take care of these drivers.
Stakeholders in the oil and gas sector applauded the initiative.
So we hope that all of us will continue to be healthy and will continue to drive in a better way the society provides. Very important that from time to time we will have to be checking our blood pressure and other aspects of our body, so much so that we will not fall sick.
The insurance is part of what we have been thinking about. When our leader said we have to make sure that those people who are providing all we have been proud of, something have to go back to them. And that is how we think of what is happening today.
We would like to thank the Mother Union, that is NUPENG, for this laudable program of health insurance for tanker drivers. We believe from this one, as we are talking into the program, we will no more lose our members.
But for today, we are launching insurance, health insurance for our drivers. So I would be very happy if this program could last long.
The National Health Insurance Authority Act 2022 was established to provide for the promotion, regulation and integration of health insurance schemes in Nigeria. For Alaide and other workers who thank their leaders, health is indeed wealth.
Achieving a comprehensive healthcare plan is not just the business of government or a private citizen. It should be a collaborative effort to ensure that public health is being enhanced. It's also a human right to have access to quality healthcare service.
I guess the best thing we should first look at is what is causing the brain drain. Why are medical experts leaving the country? They are only, they leave for greener pasture. That is just the essence of it. So the best thing our government can do in the country is by improving on the incentives of this set of people. So because when they leave, the only thing that actually attracts them to all these overseas jobs is because of the difference between what they are being paid here in Nigeria and what they are offered over there. So if government can increase the incentives, then the condition of service, and if all those things are okay, then most of them will is that they come back and do up, and those people who are present, still in the country won't leave. That is the only thing I believe our government should do for them. And then the equipment that they are exposed to here, that they use for their jobs. As it is now, medical doctors, medical professionals, not only medical professionals, health practitioners, health professionals, they are leaving the shores of Nigeria daily. You understand? And this is having deleterious effects on the health service delivery in Nigeria and in the country as a whole. You see, where we don't have enough doctors, the patients will suffer. On the average, the WHO recommendation for a doctor-patient ratio is 1 doctor to 600 patients. But what do we have today in Nigeria? On the average, is 1 doctor to 10,000 patients. How do you want the doctors and how do you want the system to cope? So the patients are definitely suffering. People that need health care are not getting the quality health care they deserve, and they are not even getting in. They don't have access to that health service delivery, health care. Do you understand? So it has so many effects. Number one, the citizens are the receiving effect. And this, a healthy nation, a healthy people is a healthy nation. You understand? So if a large chunk of Nigerians are not healthy, that means the nation is sick. So as it is, what is happening to Nigeria is not something we can describe. You understand? Why? And it's to every state, not Nigeria as a whole. Do you understand? So these the effect is not something that you can measure. Is unquantifiable. You understand? Because it goes a long way. When you don't have healthy youth, when you don't have the aged that are not healthy, because they don't have people, they don't have healthcare professionals to take care of them. Because you cannot blame these healthcare professionals for leaving the shores of the country, because everybody wants good life for him or herself.
On the profile interview this week, I'll be speaking with the acting president of Medical and Health Workers Union of Nigeria. It brings us up to speed on some of the challenges workers are faced with, the fight for decent work in the sector, and the need for the federal government to look into the brain drain that the country is faced with, especially in the medical and healthcare sector.
It's good to have you on the program.
Thank you.
A lot has been happening in the world of work, especially in the healthcare sector. But first, let me ask you the question about the welfare of workers in the healthcare sector. How would you assess the welfare of workers? Would you say it has been fantastic?
Well, actually, as you said, a lot has been happening in the world of work, especially with the current economic situation. Health workers are not exception. I can say that the welfare of workers can be termed as moderate because I believe a lot need to be done to improve the welfare of workers in their working places, especially as health workers that are attached with a lot of hazards in their working place, their environment, their equipment, logistics, and so on. I believe there is need for improvement. So the welfare of workers in the country, particularly the health workers, need to be improved.
Okay, very quickly, we also know that there's this issue of brain drain that Nigerians are that the country, is faced with. Particularly, we've heard of reports of some states not even having some certain professionals or consultants to actually work with, to attend to patients. And what has been the on-the-spot assessment of this reality as the acting president of the union?
Well, I think this is also real. Nigeria as a country is facing brain drain in almost all the professions in the health sector. Medical and health workers not in exception. Recently, I was in one of the states on an official assignment. I was made to understand that some health facilities were closed because of lack of manpower. So I think this is an issue that needs to be addressed by the government because the population is increasing day by day. And there is need for more manpower in our health facilities to take care of our patients. But unfortunately, you can see that a lot of workers are retiring and government is not using that opportunity to fill the gap. So obviously there is a lot of brain drain. And looking at the salary package also and other welfare packages to workers, you can see that a lot of health workers are fleeing out of the country for greener pasture. So I think obviously there is need for government and the leadership of the Professional Healthcare Workers Union to collaborate together so that together we can address this issue.
Talking about retirement, we know that, like you said, we have a lot of people that are retiring from the system. Personally, as a young person too, I know of many people that are supposed to be working in the hospital that are ready to even stay back in the country, but they do not have that job opportunity and they end up in the banks and probably owning small-scale businesses. What will be your message to the federal government and relevant stakeholders in terms of ensuring that they employ more people? And perhaps would this be a message to the federal government that their promise towards ensuring that we have more people in the labor market can be fulfilled via the healthcare sector?
Yes, it's true. I think the call is paramount not only to the federal government, including the state government and by extension the local government, because there are a lot of health workers at the local government level that manage our health clinics, health posts, and small hospitals in our rural areas. Initially, if I could remember, health workers graduated at once. Like you can find a school where about 200 health workers were employed at once. So by implication, those workers will retire at a time. So for you to fill that gap is an issue. So I think government at all levels should ensure that employment of health workers should be a routine issue. Not only that as a time that they should make it as a policy that they should only employ health workers once in 2 years or so. It should be a routine issue because the population is increasing and then health workers are retiring. So obviously that gap needs to be addressed. And there are some certain specific areas that need more manpower. So obviously I think it's very important that government at all levels should consider the employment of health workers as a priority.
How would you rate the issue of pensioners generally? You are also Deputy President of Nigerian Labour Congress. Would you say they are faring well?
Based on my personal assessment from all sectors of the economy, including the organized private sector, I think the pensioners in the country are in a pathetic situation because it's there in our media how you can see that pensioners from all sectors are protesting for their retirement benefit. First of all, the issue of payment of gratuity. That issue is something that needs to be addressed because outstanding gratuity is accumulated at the federal level, at the state level. Pensioners are suffering. They cannot even take care of their medical needs. They don't have houses, they don't have shelter, and so on. So I think the issue of pensioners is another issue that needs the attention of the government because they are not finding it easy. I could remember when we have the discussion, one of the discussions with the federal government on the issue of the removal of fuel subsidy. The federal government, in its efforts to cushion the effect of the removal, said they will provide palliatives to the poor of the poorest. And we argue that pensioners should be added in that. But they said they are receiving monthly pension. But we argue that how many pensioners will go a long way that their monthly pension can take them 2 weeks. I don't think it's peaceful in this country. So we argue that obviously the pensioners need to be included, and at the end of the day, the federal government agree with our facts and they included them. So I think they need to be looked often, both at the federal and state level.
Okay, even though we know that they actually have to be taken care of and they also have to enjoy the palliative nets that other workers might be enjoying, would there be a message to the state government on how they handle pensioners, and especially when it comes to the state government not believing in gratuity moving forward? What will be your demand? What is the medical and health workers' stand on the issue of gratuity most especially, and the state government also even paying the pensions promptly?
Well, I think the issue of pensioners, as I said earlier, is not peculiar to health workers alone. It's an issue that has to do with the entire workers of that state, because you cannot expect that in a state some category of workers will be extracted to be paid their monthly pension and gratuity and leaving another pensioners. But the issue is general. Majority of the states don't take the issue of payment of gratuity as a priority. I bet you that if you go around the 36 states, probably you will see that there is a lot of accumulated outstanding gratuity. Only very few states from the records have cleared outstanding gratuity for their workers, and they are prompt in their payment of their monthly pension. But I think it's very paramount that the issue of pensioners also need to be taken with all seriousness, because leaving it to accumulate is what is bringing the problem. You see that a gratuity have started from 1 billion, 2 billion, and it will reach up to 40 billion. And if it reach up to 40, 50, how can a state government pay it at once? I don't think it's going to be feasible. So I think there is need for state government to ensure prompt payment of gratuity and prompt payment of monthly pension, because majority of these retired workers don't know anything apart from work. They have retired and they don't have anything. It's only the monthly pension, and if they have not been paid their monthly pension, how do you think they can cope with their family? They have family, they have served for 35 years, they have children, they don't have anything to do. So I think obviously there is need for the government to look at the plight of our retirees.
The issue of the removal of fuel subsidy and how state governments are the biggest beneficiaries. What would be your take on expectations from state governments, who are the biggest beneficiaries of the removal of fuel subsidy, when it comes to workers' welfare, when it comes to pensioners, when it comes to maybe infrastructure and things that would ensure that we live a decent life? What would be your expectation from state government?
Well, the expectation is that with the money accrued from the removal of the fuel subsidy, which by implication translates that state government will get more money to do more infrastructure and improve the welfare of its citizens and the workers and pensioners. So obviously I believe that the expectation is very high, and we feel that the salary of the workers, their welfare, and the payment of the outstanding gratuity, pensions, and other things should improve at the state level. Because I could remember few months ago, or I can say last year, before the removal of the fuel subsidy, state government in a month, at the federal government level, I think at the federation account distribute about 500 to 600 billion naira in a month. But now it has risen to over 900 billion, up to 1 point something billion. So I think it's very paramount that state government should improve at the welfare of the workers, the pensioners, and the citizens. Very few of the states in the federation have started even implementing the 35,000 wage award, which is very discouraging, and I think there is need for other states to immediately start implementing it. And the 35,000 is a benchmark as agreed at the federal government level. So states are at liberty to even improve above the 35,000 for the welfare of their workers, and including additional palliatives and so many other things to cushion the effect of the removal of the fuel subsidy. So there are a lot of expectations to them, which we hope they will key into.
Finally, I'll take you back to your sector, which is medical and health. There used to be this professional rivalry, especially when it comes to seeking managerial position. Many a times it's given to the doctors. Would you say that there's been an improvement in this trend?
Well, first and foremost, I think this issue of professional rivalry is not healthy to the development and progress of this country, particularly in the health sector, because to me it's creating a problem to the detriment of the patient. So I think a lot needs to be done to address this issue. And fighting for managerial position, which, as you rightly said, is aligned to a certain profession, I think also need to be addressed. Although there are a lot of improvement, because I know of so many states in the country that initially decided that appointing an honorable commissioner for health is a birth rate of one profession. But presently there are a lot of improvement, because we have some of our members and other members of other professionals that are appointed as commissioner for health. So I think it's something that we can say there is improvement, and if that will bring sanity and peace in the health sector, so that together we can work as a team, I think it's a nice development. And we pray that it will be a continuous process so that we will have peace in the health sector, and the management and treatment of our patients will improve in the country.
Thank you very much for your time.
Thank you very much. I appreciate you.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.